Item 27, recommendation that the resolution 016 be referred.
Before you is item 27 with a recommendation for referral. Is there discussion? Microphone 6. Microphone 6.
Yes, Charles Lopresto, Delegate, American College of Physicians, speaking on behalf of the delegation against referral and in support of the original language. The American College of Physicians has always been a strong supporter of ensuring migrants have access to health care. ACP has several strong policies in support of healthcare for migrants that track closely with the original language in this resolution, namely our position statement on increasing access to healthcare for non-detained asylum seekers living in the United States. We call on our American Medical Association to adopt this original language, which would importantly recognize in migration status as a social determinant of health. With 200,000 new migrants in our country, many of their first encounters with our healthcare system will be already overburdened primary care specialists. Internal medicine physicians across the United States are increasingly struggling to provide healthcare to this vulnerable population. As an internal medicine specialist practicing hospital-based medicine in New York City, I cannot provide my patients with the best evidence-based care that they deserve because of their migration status. For migrant patients who arrive and have medical emergencies such as debilitating strokes or heart attacks, I cannot discharge them to rehab centers. For migrant patients who require new dialysis, home infusions, or many other examples, we struggle to find adequate resources for them. The American College of Physicians urges this House to defeat referral and support this important original language, which will help all of our primary care physicians and beyond provide the best care for their patients, regardless of their migration status.
Thank you. Microphone 6. Microphone 5.
Thank you, Dr. Speaker. Carlos Zapata, delegate from New York, speaking for the authors against referral. This resolution is more timely than ever and deserves action before our House today. Back home in New York City, many other cities around our country, increasingly entire states, and moreover in global society, are experiencing the effects of the largest migration wave in the last century. There are over 200,000 new migrants in our country, and it is a challenge to provide health care for all of them in an adequate way, and we do not have sufficient AMA policy to guide us on how to accomplish this. While we understand migration here in the United States is a very complex topic, with multiple sectors of society affected and many complex governmental policies that need adequate attention, such as funding sources, border policy, housing, work permits, etc., this resolution was written with a very narrow focus as guiding principles of healthcare of migrants. Referring this for further study would be in conflict with the original goal of our resolution, which is simply to align our AMA's policy with that of the World Health Organization, which has already been agreed upon by the World Health Organization, which is where this language was taken from. We believe it would be a waste of the AMA board's time and staff's time to study the work that WHO has already done. Therefore, New York asks you to vote down referral and support our original language. Thank you.
Thank you. Microphone 5. Microphone 5. Microphone 5.
My apologies, I thought we were going to go to another one. William Mayer, regional delegate from the MSS, speaking against referral to adopt the original language. To be clear, this resolution is not trying to solve the complexities of the immigration policy in the United States. Rather, it is asking the AMA to recognize the importance of protecting the health of migrants. Asking for a root cause analysis, which was done in the RefCom and cited as one of the reasons why this needs to be referred, is untenable, is difficult to do. While I have faith in our AMA staff, if that were to be done, I would suggest they reach out to some of our MD, PhD students, for that would make a great dissertation. There are multiple think tanks that deal in the complexities of immigration policy, and that's why we're not discussing this here. As previous speakers have alluded to, this has a narrow focus, to focus on the health of these individuals and to prioritize their health as it relates to the public, but also our country. And so I ask once again on behalf of the MSS that we defeat referral in favor of adoption of the original language. Thank you.
Thank you. Microphone 5. Microphone 5.
Joe Sellers from New York, speaking for our delegation and against referral and in support of the original language. This is a resolution that came from MSNY. I just want to echo support for what Dr. Lopresto and Dr. Zapata were so articulate in expressing. And again, the key point here is that migration status is a social determinant of health. And as physicians, in order to do our work, we need to address it. We need to address it now. We don't need to refer this for study. This is well put together resolution, and I would ask my fellow physicians to support it for us. Thank you.
Thank you, microphone 5. Microphone 4.
Thank you, Dr. Chair. My name is Tony Ann Lewis. I'm a representative of New York, representing the New York delegation, speaking against referral and in support of the original language. To provide further testimony in agreement with my colleague from New York about how the language from the World Health Organization is already sufficiently vetted, we asked to consider the following as a summary of the work that went into crafting of this language and relevant participation of the United States government. The Colombo Statement was the outcome document at the 2017 second high-level meeting of the Global Consultation on Migrant Health, a multilateral meeting hosted by the World Health Organization and the International Organization for Migration, which is a United Nations work group known to be the leading intergovernmental organization in the field of migration. The United States Center of Disease Control and Prevention participated in crafting of this language. The United States government has since reconfirmed its support of the Colombo Statement through its participation in the third global consultation on the health of refugees and migrants in June 2023. This WHO language is a direct language that appears in resolved clauses 1 through 5. Additionally, in May 2023, the U.S. government was official co-sponsor of the WHO resolution WHA 7614, which was the resolution that member states adopted to extend the Refugees and Migrants 2019 to 2023 until 2030.
Please conclude. Please conclude.
So, in order to conclude, I basically want to present the fact saying that this resolution was already sufficiently investigated and is not needed for referral.
Thank you. Microphone 4. Microphone 6.
Ben Hoffman, President of the American Academy of Pediatrics, speaking on behalf of the pediatric delegation in opposition to referral and in favor of the current language. 1 in every 4 children in this country were born in another country or have a parent who was born outside the U.S. These kids are here. Every child deserves to have equitable health care that is sensitive to cultural differences, mindful of global health concerns, and that supports resilience and integration into the community. The Executive Committee of the American Academy of Pediatrics went to the border several months ago, as we have done every year. We witnessed the hardship and heard stories from families who had been able to immigrate into this country. I see them in my clinic. We cannot ignore them. This is an issue of urgency, which is why I feel like we cannot afford to refer it and need to stick to what is currently in the language. Thank you.
Thank you, microphone 6. Microphone 5.
Thank you. Frank Dowling, a New York delegate, speaking on behalf of the New York delegation, opposing referral and asking that we pass this original resolution today. This gives us very strong, well-vetted policy, and anyone who has concerns that felt that referral was indicated can look at this as a delegate, as a delegation, as a council, as a board, and bring something right back to the next House to tweak this if need be. So let's pass this today. Let's take care of people. That's what we do, take care of patients and take care of ourselves, and leave the rest of the politics outside. So please, let's get back to the original and pass it today.
Thank you, microphone 5. Microphone 3.
Yes, Jenny Hall from the Senior Physician Delegate Section. Thank you. I'm speaking as an individual, and my conflict of interest is I volunteer at a free clinic where we see undocumented immigrants. They are people and they need care. So let's pass the original, and I'm against referral. Thank you.
Thank you, microphone 3. Dr. Briggs for the Reference Committee.
Yes, your reference committee heard testimony in general support, but there were complex other issues that were identified, as you can read in our paragraph following, and so we felt referral was more appropriate. Thank you.
Thank you, Dr. Briggs. Microphone 6.
Arlene Seed. delegate for the American Association of Public Health Physicians speaking against referral. This is an urgent problem. I have this problem currently in my state. We don't have good policy, and we're not really good at deciding who and to take care of these people, but it's not really a priority. So for these reasons, and for the issues that are currently going on, we need to pass it now. So Arlene Seed, speaking against referral.
Thank you, microphone 6. Microphone 5.
Yes, Howard Shodash, speaking as an individual. Healthcare for migrants is vital because it's healthcare for everyone. We have a lot of migrants. Unfortunately, we are not doing a lot of screening of a lot of these migrants coming in. We've seen an increase of various infectious diseases and other illnesses that wind up spreading to people that are already here that are non-migrants. So we shouldn't worry about the politics of this, but we should worry about the health of America in general. And therefore, I'd recommend not referral and passing this.
Thank you, microphone 5. Seeing no further delegates at the microphones, we will proceed to a vote. You have before you item 27 with a recommendation from your reference committee for referral. If you wish to consider this resolution, you will vote no to defeat referral. Otherwise, you will vote yes for referral. So many as favor referral signify by saying aye. Aye. Opposed? It is not referred. Before you is resolution 16, item 27. Is there further debate? There is no further debate. So many as favor adoption of resolution 16, item 27, signify by saying aye. Opposed, nay. You have adopted item 27, resolution 16.